Have you ever walked into a room and suddenly forgot why you were there? Maybe you laughed, maybe you blamed stress or being distracted. But what if I told you that tiny forgetfulness make the echo of something much bigger? Hello everyone, my name is Ari Khusuma, M.Biomed from Poltekkes Kemenkes Mataram. It's an honor to be with you in this special occasion. Every 3 seconds, someone in this world develop dementia. That is what the World Health Organization tells us. But here's what they don't tell us. Every day, we brush our teeth, we monitor blood pressure, we track blood sugar. But how often do we check in with our mood, our focus, or our memory? In healthcare, we must start treating the brains not as a mystery, but as a vital organ we care for daily. Most people never see brain disease coming, not because there were no warning signs, but because the brain is often the last part we think to protect. Today, over 55 million people live with dementia, and every year we add 10 million more. This is not just a medical issue, it's a human issue, impacting family, emotions, community, and dignity. Okay, let's start with the first one. Prevention is better than diagnosis. Let me tell the truth. Brain health doesn't start in the brain. It begins in the heart, in the gut, and even in the air we breathe. Research shows that hypertension, diabetes, obesity, and air pollution raise the risk of stroke and dementia. The problem is, these risk factors start young, but brain symptoms always appear late. That's why public health professionals matters. Nurse, nutritionists, physiotherapists, laboratorians, they are the first line of defense. In Finland, national dementia campaigns began at school through nutrition and cardiovascular screening. In Indonesia, Poltekkes can do the same, embedding brain health in community screening and health talks at campus health day or something. You know, every movement always matters. Number 2, innovation should be local, not just high-tech. When we hear about innovation, we always think about AI, brain scans, and robotics. But innovation isn't always expensive. Sometimes it's simple, local, and human-centered. Like a midwife explaining postpartum mental health in new mothers, or a lab team detecting early inflammation linked to neurodegenerations. Or students design a simple mobile apps to remind seniors about medications and test their memory with daily quizzes. The true innovation must be inclusive and fit the local culture and context. Number 3, cares mean collaboration, not just cure. Here's the reality we must accept. Someone with Alzheimer's doesn't just a neurologist. They need a caregiver who understands emotional change, a community that welcomes them, and a health system that is proactive, not just reactive. Brain care is not a job of one profession. It's a shared responsibility. That's why our health education must break this problem. Whether you're a nurse, midwife, or public health officer, you are part of the brain health system and ecosystem. We must train students not just with knowledge, but with the empathy, teamwork, and interdisciplinary awareness. Because brain health is not just a specialty, it's a collective mission. So, the next time someone forgets your name, don't just laugh it off. Maybe you can ask, "Are you okay? Are you overwhelmed?" And anything. Brain health begins at home, can happen in the kitchen, in bedtime routine, in family conversation, and many more. Let's build a generation of health professionals who recognize invisible symptoms, who care for the silent organ, and who act before the disease begins. Because when we protect the brain, we're not just saving memory, we are preserving identity, dignity, and life. Let us become professionals who listen, even when the brain speaks softly, because brain health isn't just about cure, it's about care, it's about connection, it's about all of us. Thank you so much and see you next time.